Hi everyone, welcome to Pep Talk. I'm Pauline Morini, and today we're going to talk about physical therapy and how this type of treatment and its techniques can improve your day-to-day activities, reduce pain, promote the ability to move, restore function, and prevent disability. I have here with me today a very special guest, Cindy Langer. She is a physical therapist and she'll walk us through the topic and answer all of your questions. Welcome, Cindy. Thank you so much for coming. It's a pleasure to have you here.
Thanks for having me. Thank you very much. Congratulations on the new show.
Thank you. Thank you. So, Cindy, would love to hear about you. Let's learn about you. So, what is your passion? Why did you become a physical therapist? Tell us a little about yourself.
Great question. Interesting question. When I was young, I would work out. I was a little heavy as a teenager. Okay. And I would do every exercise show I could come up with, and I would even march up and down the stairs and wear a hole in the carpet. And I always thought, like, what do I want to do? What do I want to do that's similar to this interest in exercising? And my school counselor said, you know, you should go into physical therapy. And that was sort of it. I went to UConn and for my bachelor's degree, and I went to Quinnipiac for my master's degree. Okay. And I've been working in outpatient orthopedic settings, and now I have my own business in
That's amazing.
Avon. Thank you.
That's amazing. Tell us a little bit about what is actual physical therapy and what are the misconceptions usually you get from people?
Yeah, and that's another great question. Physical therapy, we have a wide range of people that we can see. We can see children, we can see geriatrics or elderly, we can see everybody in between, we can see neurological patients, we can see orthopedic or musculoskeletal types of patients. So in my setting, I do see orthopedic-based or musculoskeletal patients. And we are able to evaluate people. If they've been injured, they can come in, and in Connecticut we have direct access. Okay. So they can come in and say, I have something wrong, and we will go through a full evaluation with them, go through a full history with them. So we're able to evaluate the person's condition, put a diagnosis or assessment on what we think is wrong, and then we go through and carry out a treatment plan. And I think the treatment plan is where a lot of the misconceptions come from. Okay. A lot of people feel that physical therapy is just delivering exercise to people, showing them exercises, having them do exercises, or taking them for walks, doing things like that. But it involves so much more than that. It involves more of hands-on techniques, various hands-on techniques, whether it be joint mobilizations or manipulations, massage, dry needling, cupping, instrument-assistive soft tissue mobilization, muscle energy techniques. There's so many different techniques that we actually do with people versus just exercise alone.
Yeah, that's amazing. So what are the actual benefits of physical therapy, and when should we seek help?
Yeah, what is really good about that, asking that, is that people will wait out injuries, and we can evaluate a condition. We can then treat and come up with a plan of care based on that condition fairly immediately, depending upon how severe it is. So if it's something that somebody, for instance, would come to me and say, you know, I think I ran and I pulled something, not sure, I can evaluate them and determine that whether they do or don't need to see a physician for that particular condition. And then at that point, I would then go forward with the treatment plan, and they will heal a lot faster, and the condition will be improved a lot quicker if they come to see me right away. And I always joke around with people, don't go to Dr. Google, don't go on the computer, and don't try to solve your issue with that, because then you waste more time getting to the root of the problem, and you don't necessarily, you know, that you might not fit that particular diagnosis or that particular plan of care that the computer's giving you. You may be matching up the wrong symptoms or the wrong issues on the computer. So when people see me, I like it when they come in earlier than later. It's a lot easier to help somebody through their condition and get them better faster, to get them back to what they enjoy.
So if you're an athlete and you pull the muscle, how long should you wait until, for example, they come to you?
I usually give people like a few days. Give it a few days. If after a few days it's not improving, you still have pain with whether it be squatting, walking, just getting off the chair, you're still having pain, it's not improving, If it's been a few days, you should probably see somebody, because
Okay.
other things set up, like some compensatory issues happen in your body, and it's not necessarily in that particular region that you hurt. It can be above and below it, that you're going to set up some changes in your soft tissue tension, you're going to set up changes in strength, and that can happen fairly quickly. So I usually say give it a few days, and if you haven't been able to see some changes, then you should probably come in.
Okay. And can you tell us a little bit about the most common symptoms or complaints that you get from your patients?
Yeah, I see everything. I see everything. I have seen from the toes to the head. As a physical therapist, we treat the entire
Everything.
body.
Okay.
Yeah, the entire body.
That's
and again,
good to
in my
know.
field, it's musculoskeletal. So it could be headaches, it could be TMJ or jaw pain, it could be neck pain, shoulder pain, everything in between. I've seen people who have to have bunion surgery but don't want to. So
Okay.
I'm more treating them for hopefully restoring as much mobility that I can. So there's lots of issues: shoulder impingement, rotator cuff, bulging discs in the neck or back. I've seen tennis elbow, golfer's elbow, hip impingement, any issues with the hip that involve sort of a tendinopathy or strain to the hip.
Okay.
Knee injuries, lots of meniscus injuries,
Okay.
ankle sprains. There's many issues that I treat.
And it doesn't matter the age?
No, I've seen anywhere between 14 and about 86
Wow.
years old. Yeah, I see all different ages. There are physical therapists that will specialize in certain age groups. And again, in the outpatient or orthopedic, where I see more musculoskeletal conditions, I do see a wide range of ages.
Okay, that's awesome. So now that we're talking about that, can you walk us through a little bit what happens during a session?
Sure.
What do you guys do? And just explain to our folks watching what happens during your section.
Yeah. When I see people that come in with a certain complaint or injury, something that they think happened, and the first thing that I do in the initial evaluation process is go through a full history with them.
Okay.
So I want to know exactly what led up to that. And it's sort of like a super sleuthing. I always call it like a spy. Like you're trying to find out, well, where were you? What were you doing?
Yeah.
What happened? And then I even back it up and say, well, what were you doing a few days before? Because sometimes
Wow.
that particular moment that they felt something wasn't really that dramatic. We call it a mechanism of
Just
injury.
the final drop.
Something happened,
Yeah.
the straw that broke the camel's back.
Yeah.
So I do a very detailed history with them to find out
Okay.
like, what could have happened, if there isn't anything definitive where they fell or something. And then from there, I go to the physical exam, and that includes range of motion testing, so movement testing of even above and below where they think they're injured, again, to kind of catch where there might be other compensatory issues that popped up. I go through muscle testing to check their strength. I'll go through sensation testing to see if they lost
Wow.
any kind of sensation from their nerves.
Okay.
Maybe there's something going on there. We do reflex testing also, and joint testing to see, are they lax in their joint,
Wow.
are they stiff in their joint. So there's a lot of different things
going
that I
on.
want to go through first to make sure I have all the information I need to come up with a treatment plan.
Okay.
Then once I come up with a treatment plan, what I put into the treatment plan is to try to say, okay, what were the issues? Do I have soft tissue issues? Do I have length tension issues in the muscle? Do I have strength issues? Do I need to strengthen the muscle? Do I have joint issues where the joint's not moving appropriately? It's stuck or it's stiff. And so with that, I might choose different tools that I have in my bag
Different
of tricks.
techniques.
Right, different techniques. So soft tissue, I pull out maybe cupping or dry needling.
Wow.
Soft tissue massage, I'll use some trigger point work with my hands. I'll do some deep tissue massage. I might go into joint mobilization, where I would have them, where I try to work on their joint. I might use a strap for that sometimes, because I need the leverage on that particular joint, like for the hip or the back. And then also I might just take them through stretches. I might grab their arm or their leg and just help them stretch more into a range that they're not comfortable with. And it may be a matter that they're just not comfortable with that much range of motion, but if I do it for them, then it's a lot easier. And then I might take them through strengthening exercises or exercises that I want them to do to reinforce what I just did with them.
Okay.
And that, I feel, is one of the most important things, is that I can't follow them around.
Exactly.
And so whatever...
You don't live with them 24/7.
don't live with
24/7.
them, right? So I always say, be me. When here are some things to be me. Here are some things to mobilize yourself, to stretch yourself, to strengthen yourself, if it's appropriate for their plan of care.
Okay.
And so I always give them some resets or their own exercises that they can do to help keep everything the way we left it when they left me.
That's awesome. And how long does it last? Oh, a section, for example.
Each visit, I usually work with my patients one-on-one for about an hour.
That's
I usually
awesome.
go sometimes a little over, depending upon what we're working on. I always try to give enough room for each of my patients to have that much time. I also see some people 30 minutes if I know it's something easier that I need to work on with my hands. Maybe it's a recheck, then I'll do 30-minute visits. But almost all of my patients I see for an hour.
Wow. And then you mentioned the needles, and to me it was a surprise that physical therapists do that.
Yes.
That's amazing. I mean, can you talk a little bit about that?
Yeah, the dry needling is something that we use, very small, thin needles. They're monofilament needles. And I use the dry needling for trigger points. So I'm going to use the needle directly into the trigger point of the muscle to help, again, relieve tension in that area.
Okay. Wow. And do you see instant results? How does it work? I'm really curious about it.
Some people do find instant results. Some people, depending upon how long they've had the condition, how inflamed they are, how irritated their nervous system is, and how irritated that muscle group is, I would do more sessions to really have the most benefit. But some people do find immediate relief of pain. I've had several patients come in the next time that I see them and say, I have had this buttock pain for like 2-3 months, and I've had therapy before and I never had that. And after that session was the first time I have not had that pain. So it does have dramatic benefits, but I always warn, like, it may not always fit that necessarily, but it does have that kind of an effect on the on the muscle
it really
tissue.
helped my husband when he told me that he had done that. I was like amazed and surprised the power of this tool and this technique.
Right.
So one thing that I'd like to understand is that what happens when that needle touches the muscle? So why does it, work on such relief to the patient?
There's a lot that happens, and I think they're still trying to study and figure out exactly. There's some, I would say the studies have shown some theories of what happens. The needle goes in and irritates that trigger point. So there's going to be a response to that irritation. There's going to be a circulatory response or increased blood flow. There's going to be maybe a little twitch or contraction of the muscle. And when those things happen, you're going to get the nutrition from the circulation, and you're going to get the contraction, which helps relax a muscle. After it has that little contraction, it's going to relax more. So you get those two things happening. There's also some other, again, theories or ideas that you get a nervous system kind of feedback that it tells the brain that the area is now a little bit more relaxed, there's less tension, almost like the warning system has gone off. And so there's that component. There's also the component that you relieved tension in a muscle that was there for a while. So there were some other toxins and things inside of there that now get released back. So I always tell my patients after needling, drink a lot of water. You may want to, for just the needle going in, you may want to do ice or heat just to relieve any soreness. But the water effect is important. I also tell them sometimes they have that nervous system issue that where they're more relaxed after. Some people have a relaxation phenomenon where they're more relaxed after treatment. Some people have a little high or like an uplift to their mood after they've been needled. There's various reactions.
Wow, I would love to try that.
Yeah. It doesn't happen for everybody, but I know for me personally, I did feel like, wow, I feel like I have so much energy. I didn't feel like going to sleep. I was all full of energy. So it depends on the person.
Wow. And then you also mentioned cupping, right? And I haven't heard of it. So can you just explain a little bit about?
The cupping is kind of another technique that people have been using for a really long time. It's an ancient technique using different tools way back. They allowed the tissue to be lifted versus a massage technique where we're more pushing down and we're depressing like trigger points and we're trying to release tissue that way. The cupping actually lifts the tissue up into it. Most people may have seen like on YouTube pictures where the cup is a glass cup and it's being lit, a little piece of cotton with alcohol and it's being lit to create like a change in the oxygen, I think, level of what sucks the tissue up into the cup. I don't use that particular method of getting the suction under the cup. I use silicone cups or a hand pump or even a vacuum.
Okay.
When that goes on the skin, it's going to lift the skin, it's going to lift the fascia, and it's going to lift the muscle up into the cup.
Okay.
So you're going to get increased circulation again, and then because of that lifting, you're stretching the tissue slightly. So you're going to get that stretch effect too of the tissue. Some people have seen cupping where I think Michael Phelps was on TV with all the marks on his back.
We saw that.
It doesn't have to be that way. It doesn't have to be that you leave marks on people. There is that part of cupping that you can have, and there's the part that's more mild, right?
Yeah.
Where I use cups as a massage technique. I will move the cups as they're pulling up and go in the direction, for instance, up the back and around the shoulders, or in the legs I'll use it. And that pulling effect, I'll try to use more like a massage effect. I may then dock the cup and use it more statically. And if I did leave it there longer than a few minutes, I would get that hickey effect or that marking effect. So there's different ways that you can use the cupping. I've also used the vacuum. I have an actual vacuum cupping machine where if I want to move somebody's fluid that's been built up in their legs, for instance, an more elderly patient had that. I elevated his legs and I just moved the cups along his legs while his legs are elevated to push that fluid out for him.
Wow, that's amazing.
It was dramatic to see that his legs really got a lot thinner. They weren't as deep with fluid, some of the fluid that was stuck there. So his legs felt more comfortable because he had that done.
Wow, that's amazing.
So cupping is it's a nice tool. It's a really nice tool to use with people.
Yeah, so that you mentioned the elderly. Can you tell us a little bit about the difference between treating athletes and just, regular people?
There's differences and then there's not differences.
Okay.
It's all in what's their goal.
Okay.
So the conditions are very similar. It's that maybe their goal might be for an athlete, for instance, a CrossFit athlete might say, well, I want to be able to get back to being able to do a deep squat. I can't do a squat. But the elderly might be the same as I can't get off the chair comfortably because something hurts in my knee, and so I have to kind of shift off it. So treating them, some of the tools that I use would be maybe exactly the same, but their goals are going to be different. So maybe not necessarily with somebody who's elderly, I might not ask them to do a certain amount of weight loaded squats, whereas I know for a CrossFit athlete, they might have to be loaded when they do that squat. They might want to keep working on that. That's one of their goals. So the treatment plans or the techniques I would use would be very similar. I've used needles and cupping and deep tissue massage on elderly as well as athletes too.
Wow, that's amazing. Yeah. Do you want to do a little demo for us so we can see some, techniques?
Yep, that'd be awesome.
Awesome. Thank you. All right. We're here with our volunteer and we're going to check it out, some hands-on techniques that Cindy has for us.
All right, here we go. So I'm going to have him bend his knee. So some of the techniques I'm going to go over, typically I might be standing a little bit differently. I might have just a different approach to it, but for demonstration purposes, I'm going to stand on this side of him, and I am also going to work on his lower leg. We're going to go over just the needling quick, and then the cupping, and then I'll just show you some soft tissue massage. So for the needling, we're going to go in, and usually I prep the tissue with some alcohol. Usually swab it down. I also swab my own hands just to make sure, again, we have a clean area. And then I have the needle here, and these again are very small. Usually most people don't feel them at all.
Wow.
In the calf area, he may feel it a little bit more because it is a big muscle group. And what I'll do with this area is just try to go right into, again, that trigger point. So I'll give that muscle a really big grip on it. Try to get it in my hands, and then we'll just do a quick movement in there, and then just going into the tissue. And he's being really good. I can feel a little twitch in the muscle, and I can go in and out. I can leave it there and holding it. And
what's the difference if you leave it or if you don't?
If I don't leave it and I just go in and out in what's called a pistoning technique, I'm getting a little bit more of the muscle, that trigger point.
Okay.
It's a little bit more reactive. I'm going to get some more reactions, more cramping, more tensioning around the needle. So if I want to get more of a release, I will go into the pistoning. But I don't have to have that. I can leave it. And that will also have a very positive benefit because of the irritation it's creating. The muscle will respond to the just being left in also. So I'll take
what
that
are
out.
usually the conditions that you treat with needles?
All kinds, really, all
Okay.
kinds. Any kind of neck problem, back problems, shoulder problems, headaches again.
Okay.
Again, I've had a bunion patient who I've worked on the muscle tissue as it leads up to her toe region. So I use it quite a bit on
Okay.
a lot of different conditions. So I'm just going to wipe that off. And again, that was it.
Wow.
And then let's do a little bit of cupping to show you guys that.
Yeah, I can wait for that.
So we always want to use a little massage oil. I use coconut oil. And I'll show you on this side of his leg, but I will usually do in the lower leg on the other side for shin splints. And this is the cup. Okay, these are silicone cups, and I have various sizes.
Wow.
And his leg, I'll use maybe this cup. And you
Okay.
can see how I'm kind of dragging the tissue up. And then I release. And again, I'm showing you on this side of his leg. And so you guys can see it. And you can see that tissue's being brought up into the cup. I'll show you with another one so you can see it better.
Wow.
And I'll show you with a bigger one so you can see that better. So in different conditions, I may leave multiple cups on for a little bit. I may then move them. I can also kind of oscillate them or do a rotation to get more of the stretching of the tissue. And then I just release that. And then the massaging technique, again, would be more of the pull up into the cup and then drag along.
And again, you use this technique for various reasons.
Right. Yeah. I, again, use the cups for multiple patients. I use
Okay.
on various diagnoses. I'll use the cups. Maybe I'll use the cupping first to get the tissue ready.
Okay.
And already have some of the soft tissue tension relieved first with the cups. And then I might go in with the needles after that so that I can get really down deeper into those trigger points. So sometimes I find that both treatments work really nice to start with.
Awesome.
And then what I was just doing after the cupping is just some soft tissue work. So I may go in with my hands and get on some of those trigger points as well. If I want to do a more gentle technique, maybe the person didn't want the needles done, then I may do more of just deeper tissue work with my fingers, trying to get right on those trigger points, and then I might just hold them there. I might hold them there and do some work like with his leg, where I might be doing some stretching while I'm holding the trigger point. And then also just some deep tissue massage. And then range of motion. Sometimes I'll just stretch people out. And in his case with his ankle, if he had an ankle problem, I might get on the end of the table and move his ankle around. And
So
or
you're
do
always
joint
getting
mobilizations.
your patient's feedback.
Yep. Yep, I would be asking, like, how does that feel? What do you feel? Even with the cupping, I would normally ask, like, is that too much of a pull? I can go lighter with the cups. And even with the deep tissue work here and the trigger points, I want to know, like, is that the most tender spot? Are you feeling pain with that? And sometimes I'll hold that pressure with my hands and ask them, when does it feel that the pain is now going away? Because that's a sign to me that that muscle is starting to relax.
Okay.
Yep. So those are the main techniques that I use most often. Again, there's scraping, which is with a tool. It's another soft tissue technique. And I also have K-tape. So if I feel like I want to hold or position a person in a certain pattern or position while they, again, are not with me, I may use K-tape. I may use athletic tape or waterproof tape to hold like a knee or a shoulder or even a hip area. I've held with taping techniques too.
Okay. That's amazing. Awesome. Thank you so much. Is there anything else that you want to add and tell our folks at home?
No, I don't think so. Just I'm located in Avon, and I'm a mom entrepreneur. So I'm a single, just business owner, and don't have any other staff. It's just me, and I like to keep it that way so I can be one-on-one with my patients.
Yeah. Give the attention that they deserve.
Yep.
Awesome. Thank you so much. Wow, we had a great demo, great talk. That was fantastic. Thank you so much for coming.
Thank you for having me.
That was awesome. I'm sure everyone at home now have a better understanding about the amazing work physical therapists do. Thank you so much for watching. Stay healthy, stay happy. See you next time.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.